Hello, I'm Dr. Ron Balkasoon. I'm a pulmonologist and contract consultant in Denver. I work at National Jewish Health in Denver, Colorado, and I'm a paid speaker for Sanofi Pharmaceuticals. Thank you for joining me for today's presentation, A Guide to Medicare Coverage and Support for Nebulized BROVANA arformoterol tartrate inhalation solution. This promotional non-CME program presented on behalf of Sanofi Pharmaceuticals is intended only for U.S. healthcare professionals involved in the treatment of patients with COPD. The information contained herein is intended for general information purposes only. It is not a substitute for your professional medical advice and judgment. Though the following presentation focuses specifically on Medicare, it's important to note that BROVANA may also be covered by commercial insurance and by Medicaid. Should you have more specific coverage questions, a BROVANA representative can provide further information and details. Okay, what about the indication? BROVANA arformoterol tartrate inhalation solution is a long-acting beta-2 adrenergic agonist, LABA, indicated for the long-term, twice-daily, morning and evening, maintenance treatment of bronchoconstriction in patients with chronic obstructive pulmonary disease, COPD, including chronic bronchitis and/or emphysema. BROVANA is for use by nebulization only. There are important limitations. BROVANA is not indicated to treat acute deteriorations of COPD, and it is not indicated to treat asthma. So, an important safety information warning: asthma-related death. Long-acting beta-2 adrenergic agonists, LABAs, increase the risk of asthma-related death. Data from a large placebo-controlled U.S. study that compared the safety of another LABA, salmeterol, or placebo added to usual asthma therapy showed an increase in asthma-related deaths in patients receiving salmeterol. This finding with salmeterol is considered a class effect of LABAs, including arformoterol, the active ingredient in BROVANA. The safety and efficacy of BROVANA in patients with asthma have not been established, and BROVANA is not indicated for the treatment of asthma. Medicare provides health insurance for those aged 65 and older, as well as those under 65 with certain disabilities. 57 million people are eligible for Medicare, and in 2015, Medicare benefit payments totaled $632 billion. Only 12% of Medicare patients have been diagnosed with COPD. However, research indicates that COPD is substantially underdiagnosed, with 12.7 million adults report a COPD diagnosis, but the number of people with impaired lung function is estimated to be as much as 24 million. The following slides illustrate how BROVANA might be covered under Medicare in various treatment settings, but coverage will be determined on a claim-by-claim basis. Medicare Part A. In a hospital or skilled nursing facility, institutionally administered drugs are covered. BROVANA is available under Medicare Parts A to D for eligible patients. There is no guarantee of coverage. Medicare Part B. In outpatient settings, durable medical equipment, DME, and certain related drugs are covered. BROVANA is available under Medicare Parts A to D for eligible patients, but there is no guarantee of coverage. Medicare Part C. The Medicare Advantage program. This allows patients to enroll in a managed care style plan with pharmacy benefits. BROVANA is available under Medicare Parts A to D for eligible patients, but there is no guarantee of coverage. Nursing home residents with stays longer than 100 days may have drug coverage under a Part D plan depending on eligibility. Again, BROVANA is available under Medicare Parts A to D for eligible patients, but there is no guarantee of coverage. Medicare Part B covers BROVANA and nebulizers, but there is no guarantee of coverage. Physicians must document that a face-to-face encounter examination with the patient occurred, that the treatment and/or evaluation for a condition supports the need for a nebulizer, and that the encounter examination occurred within 6 months prior to the written order for the nebulizer. Nebulizers are typically supplied by a DME provider. Accurate coding for all claims is essential to seamless processing. Accuracy supports quick delivery of product to patients as well as reimbursement to provider offices. Here is a quick ICD-10 coding chart displaying the codes used most often to describe COPD, along with the unique J code for BROVANA, J7605. There is no guarantee of coverage. We understand that there may be challenges associated with prescribing BROVANA. It's with these conversations in mind that we created Synovian Answers, our way of helping you help your patients. A dedicated team is available between 8 a.m. and 8 p.m. Eastern Time, Monday through Friday, to answer patients' calls in 30 seconds or less, providing a seamless experience. Synovian Answers is a comprehensive resource that can provide patients with information about BROVANA and reimbursement and can help support medication adherence. The offerings include benefits investigation and prior authorization assistance. And if patients or caregivers have access issues at the pharmacy, the Synovian Answers reimbursement specialist may be able to help conduct a benefits investigation or answer other insurance-related questions. Synovian Answers can also help resolve pharmacy rejections due to PA requirements. Pharmacy Finder. Our team can locate pharmacies that provide BROVANA, or if there is not a convenient pharmacy available, connect patients with a home delivery option. Synovian Answer works with pharmacies to help patients receive BROVANA using their medical or Medicare Part B benefit. Resource connections. Members of the Synovian Answers team will help patients and caregivers connect with organizations that provide resources for disease awareness and for the challenges of supporting a friend or loved one with COPD. The Hospital-to-Home program for recently discharged patients includes the following: the Hospital-to-Home Stocking Sell Sheet, a branded printed sell sheet providing details on ordering BROVANA and the offerings of the Hospital-to-Home program. Hospital-to-Home Claim Form, Spanish version. Hospital-to-Home Claim Form translated into patient-friendly Spanish. Online location for downloadable Hospital-to-Home program PDF. SynovianProfile.com/SP/BROVANA/BROVANA-voucher. Hospital-to-Home URL driver card, an unbranded business card-sized lead behind that drives to the Hospital-to-Home site. Hospital-to-Home program brochure, a branded lead behind brochure that DME reps can offer patients to serve as a conversation starter between the patient and their healthcare provider. You may still have unanswered questions about how BROVANA works with Medicare. Here and on the following slides, we've gathered the most commonly asked questions and provided the corresponding answers. Take a look and don't hesitate to ask if there's something we've missed. Is prior use of short-acting beta-2 agonists required for Medicare coverage? No, prior use is no longer required under Medicare Part B. There's no guarantee of coverage. The next question is, does Medicare Part B cover nebulizers? Yes. Since nebulizers are considered durable medical equipment, they are covered under Medicare Part B, but there is no guarantee of coverage. Is BROVANA only covered under Medicare Part B? BROVANA is typically covered under the medical benefit Medicare Part B. However, coverage under Medicare Part D occurs in some circumstances. Example, for patients in skilled nursing facilities. There is no guarantee of coverage, however. Next question, what must be specified in a new prescription for BROVANA? The dosing instructions, you need to mention by nebulizer, you have to provide the ICD codes, and the number of refills. Also, coverage under Medicare Part B, there is no guarantee of coverage. What must be specified in a new prescription for nebulizer? You need to put compressor E0570. You need to put administration set A7005. Also, you need to put down mask A7015 and mouthpiece A7016. There's no guarantee of coverage, and DME suppliers may require additional documentation. This concludes our discussion of COPD and BROVANA. So now I'd like to cover the important safety information. We may have already covered some of this during the presentation, but it's here for your reference. Indication: BROVANA arformoterol tartrate inhalation solution is a long-acting beta-2 adrenergic agonist, LABA, indicated for the long-term, twice-daily, morning and evening, maintenance treatment of bronchoconstriction in patients with chronic obstructive pulmonary disease, COPD, including chronic bronchitis and/or emphysema. BROVANA is for use by nebulization only. What are some important limitations? BROVANA is not indicated to treat acute deteriorations of COPD, and it's not indicated to treat asthma. Important safety information. Warning: asthma-related death. Long-acting beta-2 adrenergic agonists, LABAs, increase the risk of asthma-related death. Data from a large placebo-controlled U.S. study that compared the safety of another LABA, salmeterol, or placebo added to usual asthma therapy showed an increase in asthma-related deaths in patients receiving salmeterol. This finding with salmeterol is considered a class effect of LABAs, including arformoterol, the active ingredient in BROVANA. The safety and efficacy of BROVANA in patients with asthma have not been established. BROVANA is not indicated for the treatment of asthma. All LABAs, including BROVANA, are contraindicated in patients with asthma without use of a long-term asthma control medication. BROVANA is also contraindicated in patients with a history of hypersensitivity to arformoterol, racemic formoterol, or to any of the ingredients. BROVANA should not be initiated in patients with acutely deteriorating COPD or potentially life-threatening episodes of COPD, or used as rescue therapy for acute episodes of bronchospasm. Acute symptoms should be treated with an inhaled short-acting beta-2 agonist. BROVANA should not be used more often at higher doses than recommended or in conjunction with other medications containing LABAs, as an overdose may result. Patients who have been taking inhaled short-acting beta-2 agonists on a regular basis should be instructed to discontinue their regular use and to use them only for symptomatic relief for acute respiratory symptoms. Clinically significant cardiovascular effects and fatalities have been reported in association with excessive use of inhaled sympathomimetic drugs. Patients using BROVANA should not use another medicine containing a LABA for any reason. Immediate hypersensitivity reactions may occur with BROVANA. If signs occur, discontinue immediately and institute alternative therapy. As with other inhaled beta-2 agonists, BROVANA can produce paradoxical bronchospasm that may be life-threatening. If paradoxical bronchospasm occurs, BROVANA should be discontinued immediately and alternative therapy instituted. BROVANA, like other beta-2 agonists, can produce a clinically significant cardiovascular effect in some patients as measured by increases in pulse rate, systolic or diastolic blood pressure, and/or symptoms. BROVANA should be used with caution in patients with cardiovascular disorders, especially coronary insufficiency, cardiac arrhythmias, and hypertension. Beta-2 adrenergic agonists may produce significant hypokalemia in some patients. As with other beta-2 agonists, BROVANA should be administered with extreme caution to patients being treated with monoamine oxidase inhibitors, tricyclic antidepressants, or drugs known to prolong the QTc interval, because these agents may potentiate the action of adrenergic agonists on the cardiovascular system. As with other beta-2 agonists, BROVANA should be used with caution in patients treated with additional adrenergic drugs, non-potassium-sparing diuretics, and beta blockers. BROVANA, like all medicines containing sympathomimetic amines, should be used with caution in patients with convulsive disorders, thyrotoxicosis, diabetes mellitus, ketoacidosis, and in patients who are unusually responsive to sympathomimetic amines. The overall efficacy of BROVANA was maintained throughout the 12-week trial duration. Some tolerance to the bronchodilator effect of BROVANA was observed after 6 weeks of dosing at the end of the dosing interval, although the FEV1 improvement remained statistically significant. This was not accompanied by other clinical manifestations of tolerance. The 5 most common adverse events reported with frequency greater than or equal to 2% in patients taking BROVANA and occurring more frequently than in patients taking placebo were pain, 8% versus 5%, chest pain, 7% versus 6%, back pain, 6% versus 2%, diarrhea, 6% versus 4%, and sinusitis, 5% versus 4%. BROVANA should not be swallowed, as the intended effects on the lungs will not be obtained. BROVANA is only for the oral inhalation via standard jet nebulizer connected to an air compressor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For additional information, please see full prescribing information, including boxed warning and medication guide for BROVANA at www.synovianprofile.com/BROVANA. Thank you for joining me for today's presentation.